Welcome to Plymouth Neuropathy and Regenerative Care. I'm Dr. Schatzko, DC, board certified in neuropathy from the American College of Physical Medicine. This is Dr. Huber. He's a board certified DO in internal medicine. Our clinic is located right around 394 and 169 in Plymouth. Today we're going to talk about neuropathy. So if you or a loved one has neuropathy, this is a video you're definitely going to want to watch because we're going to help dispel a couple myths and also go over why our clinic is one of the most popular neuropathy clinics in the Twin Cities. One thing that patients always ask us is exactly what is neuropathy?
Well, neuropathy is a degenerative disease of nerves.
Okay.
And it's a progressive disease that continues to worsen unless you can change the underlying cause, which very rarely is the case.
Okay. So a lot of patients that we see, they're going to be neuropathy of either the hands or the feet. What happens with a lot of those patients, they can be diabetics, pre-diabetics, they can have chemotherapy, or they can have no known cause, and that's a very common case we see. But the same thing happens with a lot of them. They start to lose the very tiny micro blood vessels that give the blood and oxygen and the nutrients to the little tiny nerves of your feet. We're not talking about the big blood vessels, the ones that you could feel and palpate where you'd have a pulse. We're not talking about those. We're talking about the very small ones. And what happens is as those nerves, as they lose the normal blood and oxygen, they start to die or degenerate. And patients will say up front, I have numbness, I have tingling, I'm losing the feeling in my hands or my feet. And then as it progressively gets worse, they start to get stabbing pain, burning pain, electrical shock pains. And when patients progress past that point, then we have a lot of the issues where their life starts to get altered because of it. If they start to lose the feeling in their feet, it gets harder to walk, so balance can become a problem. Some of them have to stick to like a cane or a walker or even a wheelchair in really severe cases.
Affects everything in your lifestyle.
Yep. Some of those patients, they can't drive because they can't feel the gas pedals or they can't golf or be active or working out. It really plays a hindrance on a lot of those. So if a patient does have neuropathy and they go more the traditional route, they go see a medical doctor or a neurologist at like a hospital or clinic, what's kind of the normal treatment that they're going to most likely go through?
Most of the time it involves pills, and it's pills that are a thing called GABA-based medications. They typically do help suppress the nerves, and so they feel a little better, but it doesn't reverse the degenerative process that's underlying, causing the nerves to continue to get bad.
Okay. And I've consulted personally with over 1,000 neuropathy patients in my clinic. One thing that we hear a lot, or I hear a lot from them, is they always will say, well, my doctor either gave me medications or they said I was a candidate for medications, and then they really told me that there's nothing more that I could do or I'm kind of a lost cause. Is that 100% true?
That is not true.
Okay.
There are very many other modalities that are available that you know about and have been doing for a long time.
Yep.
That actually help regenerate the blood vessels and blood flow to the nerves and help regenerate the nerve itself.
Yep. And they just those treatments, and we'll go over those in a second, they just fall outside of the normal clinic and hospital treatment, which is usually going to be medications or surgeries.
Correct.
Okay. In our clinic, what we do is we try to focus on treatments or modalities that are going to be regenerative in nature, meaning we're trying to regenerate the underlying damage so that the patient can get better and then try to stop or slow the progression of the problem. And with neuropathy, a lot of it comes down to you have to try to stimulate more blood flow, oxygen, and nutrients to the tiny nerves of the feet and the hands. And if you can do that, the nerves have the potential to regenerate. If it isn't a case where they're so severe that they literally can't feel if they put like a nail in their foot. Some cases are so bad that that's just too far. But most cases, if you stimulate more blood flow and oxygen to the feet, it gives the body or those nerves the ability to try to regenerate. So then patients will say their numbness starts to get improved. They can feel more like warm and cold. Their burning pain, their stabbing pain, their shocking pain, that starts to reduce. And then they're able to start to sleep better. They can walk more, start to drive the car, get more active.
That's everything
exactly
that they do at home.
Yep. Exactly. Our success rate in our clinic is very high. A lot of those patients were told that there's nothing more that they could be done from them. And that's just, in our office, I've noticed that's maybe a small percentage of the patients, but a large amount of them, we're still able to make a significant change in their life. As far as what have you noticed with success rates with neuropathy patients?
Say most of the patients, better than probably 80% of the people that come in get some response to therapy.
Excellent.
Get some improvement. Some get incredible response.
Yep. And for a lot of those patients, that's the first time in 5, 10, 15 years they've actually gotten better. Because a lot of those patients over time, after they've been waiting, it just gets worse. They maybe take a drug that kind of covers it up. And that's one thing too. Those drugs, most patients don't know what kind of drugs are the drugs like gabapentin or Lyrica? What kind of drugs are those?
They're based off of old antidepressants or anti-seizure medicines. They're a lot related like that. They now are used to cover up or suppress the nerves so that their feet feel better when they're having nerve pain.
Gotcha. So they're not actually trying to fix the underlying nerve damage or
No.
blood vessel damage.
It quells the discomfort.
Okay, got it. A common question that we hear all the time from patients is, well, why doesn't insurance cover this? Does insurance really cover any neuropathy programs 100%?
No, nothing's ever 100% covered. Some of the medicines are very expensive and lots of plans don't pay for them. And so it's still 100% for the medicine in some forms. Sometimes some of the insurances pay for some of the medicine.
Got it. So if you suffer with neuropathy, you or a loved one, give our office a call. We'd love to sit down and talk with you and discuss your case. What we found is that we can usually help a very large majority of patients get improvements and then help live a better quality of life now and in the future. Understanding insurance is there for some things. It's not everything. Making an investment into your health and your quality of life now so that you can enjoy your life and not be severely limited down the road potentially is always a really good investment. So give our office a call at 763-710-7499. You can also find us online at PlymouthNeuropathyCare.com. Thank you.